30 important questions for the General Nursing Midwifery (GNM) program, focusing on the subject of Medical Surgical Nursing (MSN) in the second year. These questions are organized unit-wise to provide a structured approach to your studies. Unit 1: Introduction to Medical Surgical Nursing. Define medical surgical nursing and discuss its scope and responsibilities. Explain the nursing process and its application in medical surgical nursing care. Discuss the legal and ethical considerations in medical surgical nursing practice. Describe the principles of asepsis and infection control in healthcare settings. Explain the role of the nurse in promoting patient safety and preventing complications. Unit 2: Respiratory System. Discuss the anatomy and physiology of the respiratory system. Explain the nursing assessment and interventions for patients with respiratory disorders. Describe the management of common respiratory conditions such as pneumonia and chronic obstructive pulmonary disease (COPD). Discuss the role of the nurse in providing respiratory support and oxygen therapy. Explain the nursing care for patients undergoing thoracic surgeries. Unit 3: Cardiovascular System. Describe the anatomy and physiology of the cardiovascular system. Discuss the nursing assessment and interventions for patients with cardiovascular disorders. Explain the management of common cardiovascular conditions such as hypertension and heart failure. Describe the role of the nurse in caring for patients with cardiac arrhythmias. Discuss the nursing care for patients undergoing cardiac surgeries. Unit 4: Gastrointestinal System. Discuss the anatomy and physiology of the gastrointestinal system. Explain the nursing assessment and interventions for patients with gastrointestinal disorders. Describe the management of common gastrointestinal conditions such as peptic ulcers and gastroenteritis. Discuss the role of the nurse in providing nutritional support and managing enteral feeding. Explain the nursing care for patients undergoing gastrointestinal surgeries. Unit 5: Endocrine System. Describe the anatomy and physiology of the endocrine system. Discuss the nursing assessment and interventions for patients with endocrine disorders. Explain the management of common endocrine conditions such as diabetes mellitus and thyroid disorders. Describe the role of the nurse in providing education and support for patients with endocrine disorders. Discuss the nursing care for patients undergoing endocrine surgeries. Unit 6: Musculoskeletal System. Discuss the anatomy and physiology of the musculoskeletal system. Explain the nursing assessment and interventions for patients with musculoskeletal disorders. Describe the management of common musculoskeletal conditions such as fractures and arthritis. Discuss the role of the nurse in providing rehabilitation and promoting mobility in patients with musculoskeletal disorders. Explain the nursing care for patients undergoing orthopedic surgeries.